Good evening. You're watching NDTV 24/7. I'm Amitabh Revi. Has the union government made a U-turn in terms of doubling the pictorial warnings that were supposed to come in effect on the 1st of April on cigarette packs? How does that affect? Also, a controversial statement made by a BJP MP who's head of a panel that apparently recommended that this pictorial warning increase should not take place. We'll get all your views on that. You can call in. Joining us in our studios is Dr. Eswak, who is the chairman, radiation oncology with the PLK Super Speciality Hospital in the capital. We'll also be joined from the capital by the Delhi Health Minister, Satwinder Jain. Maya Sharma is with a cancer patient in Bangalore. We'll get Siddharth Pandey in Delhi and Rahul Joglekar in London to tell us what's the difference in pictorial warnings on cigarette packets there. But let's just get in what the Health Minister has currently said. JP Nadda, the government has been accused of backtracking on what the previous Health Minister was planning, that was to try and have a ban on cigarette smoking if possible.
Health Ministry is very much on its stand. It is because of the recommendation of the Subordinate Legislation Committee to keep it in abeyance till they decide, until they deliberate on it. तो वो deliberations कर रहे हैं, तब तक के लिए उसमें रोका है, लेकिन स्वास्थ्य विभाग इस बात पर कमिटेड है कि जो हमने स्टैंड लिया है हम उसको आगे बढ़ाना चाहते हैं.
Well, it seems like Mr. Nadda, after all the controversy there, Dr. Huku is saying that the government is going ahead with that plan that they were trying to implement. But tell us this whole controversy about pictorial warnings on cigarettes vis-a-vis tobacco consumption of any other kind. Now, is there too much of a focus on cigarettes being a very small percentage of tobacco usage?
You see, if you look at the tobacco habits, let's talk about India. There was a global audit which was done for the Indian tobacco users in 2010, it's like about 5 years ago. What they found was that 55% of the people in India use tobacco, and out of that 90% is chewable tobacco. Smoking or cigarettes or BD
10%.
was just 10%. Now, warnings on the cigarette packets is fine. You know, you are trying to dissuade the smoker. Discourage them. But in my opinion, education is the most important thing. Unless you educate people for, giving up this habit or not to start this habit, probably the entire packet of cigarette may have a warning, but it will have a very little effect.
Of course, people are already smoking despite those warnings,
yes,
whether it's abroad or in India. Also joining us now, as we said, the Health and Family Welfare Minister in the Delhi government, Mr. Satwinder Jain. Mr. Jain, your government has implemented just a few days back on chewable tobacco of all kinds a ban in Delhi. As the doctor here is pointing out, it's over 90% of tobacco usage is of that kind. Now tell us, with all this controversy, do you think the tobacco lobby has been pushing for, say, less pictorial or other warnings on cigarettes because that's where their money comes from and that's been working with politicians?
नहीं, देखिएगा, ऐसा है, दिल्ली के अंदर जो हमने च्यूएबल टबैको को बैन किया है, उसका रीज़न ये था कि मैं हॉस्पिटल्स में जा रहा था और हॉस्पिटल में जाने के बाद मुझे बार बार कैंसर के पेशेंट से मिलना हो रहा था जिनको ओरल कैंसर था, और डॉक्टर्स ने मुझे बताया कि सिर्फ दिल्ली के अंदर ही ऐसे कम से कम 10 से 20 हज़ार केस हर साल आते हैं और बहुत बड़ा नंबर है. काफ़ी जो लोग यूज़ करते हैं टबैको, उनसे भी मैंने बात की कि भाई आप लोग इसको क्यों कर रहे हैं, आपको छोड़ के नहीं देते हैं. तो एक दो लोगों ने तो मुझसे ऐसे कहा कि लेबर क्लास थी कि सर छोड़ देंगे. मैंने कब छोड़ोगे, कि जब बिकना बंद हो जाएगा तो छोड़ देंगे. तो हमने कहा कि इसको पहले बिकना बंद करते हैं ताकि काफ़ी लोग, कम से कम 80% लोग तो ऐसे होंगे जो अवेलेबिलिटी कम होने से या ना मिलने से बंद कर देंगे. और जहाँ तक रही कि सिगरेट वाली बात, कि मेरे ऊपर काफ़ी लोगों ने कहा कि जैसे हमने बैन किया तो उनके लेटर्स भी आए हैं, कहते हैं कि आपने सिगरेट को बैन क्यों नहीं किया. दिल्ली गवर्नमेंट जो है वो सिगरेट को बैन नहीं कर सकती, वो सेंट्रल गवर्नमेंट के हाथ में है और वो कोई ऐसा कोई लॉ नहीं है जिससे हम उसको बैन कर सकें. हम तो चाहेंगे कि सेंट्रल गवर्नमेंट इसको बैन कर दें.
Right. Prakash Munshi from Mumbai is calling in. Mr. Munshi, do you have a question for either Dr. Huku or the Delhi Health Minister, or are you stating your view here?
I'm stating both because the Health Ministry earlier had taken a stand to stop selling loose cigarettes and loose biddies, and that would have reduced considerably the smoking habits of people. Secondly, do we have to prove and go against what World Health Organization has already classified under Group 1, which is carcinogenic to humans, 3 years back? And it says tobacco smokeless, tobacco smoked secondhand, tobacco smoking.
Right.
Everything is under volume 89-100E of 2012,
Sure.
giving the cash number. So I don't think that we have enough money or enough time to waste. Do we have to wait for another 20 years to prove that
Right.
smoking is injurious?
Sure. Prakash Munshi, we take your point there. We don't have enough time. But let me just take that question. In fact, before I go to Amaya Sharma, who has a patient with her as well, who has suffered from cancer. The question, Satyendra Jain ji, is that there was a proposal that loose cigarettes would not be sold. But then there was another thought that loose cigarettes are only bought by lower income people, so there was some kind of discrimination against them. जैन साहब, आपका क्या व्यू है इस पे, सिगरेट्स पे, लूज सिगरेट्स का बैन पे?
नहीं, देखिएगा सिगरेट के बारे में तो देखिएगा, लूज़ आप बैन करेंगे ना, पीछे इन्होंने क्या किया था कि 2 सिगरेट का पैकेट निकाल दिया। लूज सिगरेट आप बैन कर देंगे, दो बीड़ी का निकाल देंगे, 2 सिगरेट का निकाल देंगे, उससे कोई फ़र्क नहीं पड़ता है। और आप टबैको में भी देखिए ना, टबैको में क्या था, सुप्रीम कोर्ट ने ऑर्डर दिए कि आप गुटखा बंद कर दीजिएगा, तो सेंट्रल गवर्नमेंट 2011 में ऑर्डर दिया कि भाई इसको गुटखे को बैन कर दिया गया। इन्होंने पान मसाला अलग से बेचना स्टार्ट कर दिया और तम्बाकू अलग से बेचना स्टार्ट कर दिया, तो वो सारा ख़त्म हो गया। अब दिल्ली गवर्नमेंट ने जो पैक्ड टबैको है, अनपैक्ड है, फ्लेवर्ड है, सेंटेड है, जर्दा, खैनी, सबको इस बारी बैन कर दिया है, ताकि किसी भी तरीके का रास्ता ना बचे। और मुझे लगता है सिगरेट को पैक, अनपैक या छोटे से पैक में उससे कोई फ़र्क नहीं पड़ता है। या तो बैन करना तो बैन ही कर दो, उसके अंदर वो रास्ता निकालने की ज़रूरत क्या है कि जी आप कहते हैं उसके लिए छोटा पैक नहीं होगा, बड़ा पैक नहीं होगा, पैक होगा, अनपैक होगा, उसके तो सब लोग इंडस्ट्री वाले रास्ते निकाल लेंगे।
जी, आप कर दिया कि if there's a ban, it should be a total ban. Let's go to Bangalore. Maya, I was speaking to the doctor just before we went on air, and there is a view that warnings may not really go down well with people who are already using it. But tell us, somebody who's actually suffering, what's his message?
Yes, I'm with Asif. He is just 34 years old. He is a father of 5 young children, and he has oral cancer, which is actually now spread to his lungs as well. Now, this is because of chewing tobacco chewing. Asif, how would you react? Or helidare tobacco in the yen kashta agalan.
ತಂಬಾಕು ತಿಂದು ನಾನು ಇವತ್ತು ನಾನು ಸಾಯ್ತೀನಿ. हेलो, नमस्ते सर। मैं तंबाकू 18 साल में खा के 20 साल में छोड़ दिया था। उसके बाद में मुझको पता चला 30 साल की उम्र में मुझे कैंसर हो गया है। मेरा छोटा छोटा बच्चा है, सब भी है। आज मैं परेशानी की हालत में जिंदगी गुजारा हूँ। तंबाकू खाने से इतना बड़ा प्रॉब्लम हो गया है। तंबाकू कोई भी नहीं खाएगा तो कितना ही की जिंदगी बच जाता है। वो सब भी नहीं बेचने से बहुत अच्छा है, जिंदगी बहुत आदमी का बचता है। हमारी हालत किसको भी नहीं आना, वैसा गवर्नमेंट तो क्या तो भी करना। अब हमने बहुत तो तकलीफ हो रहा है, खाना खाने हो रहा नहीं, मुंह खोलने हो रहा नहीं, और बहुत परेशानी की हालत में है। अब हमें तंबाकू 18 साल में खा के 20 साल में छोड़ दिया था, अभी वो इफेक्ट हुआ है हमको, उतना प्रॉब्लम हुआ है अभी। तंबाकू खा के इतना बड़ा प्रॉब्लम हुआ है।
Dr. Vishal Rao, as a head and neck oncologist, there is no doubt between the connection between the chewing of tobacco and this cancer.
I would put it this way, that I think if you look at IARC report, the International Agency for Research on Cancer, they have identified about 60 to 70 carcinogens in tobacco products. Arsenic, nickel, cadmium, chromium, benzopyrenes, nitrosamines, hydrocarbons. There are enough number of chemicals. The question would be then to ask is whether is the oxygen in India different from the oxygen in United States, or whether the nitrogen in India is different from the nitrogen in Singapore. I think the answer is definitely no. The chemicals are the same. So why is absolutely there should be no question.
Indians are as vulnerable. क्या बोलना चाहिए ये MP को?
एमपी को वही लोगों को गरीब लोग बच जाते हैं, ये सब भी रोकने से बहुत फायदा है दुनिया में, नहीं तो बहुत आदमी ऐसा हालत में मर जाते हैं।
छोटे छोटे बच्चे बहुत खाने का शुरू करी, ये तंबाकू रोकना को मैं बोलती।
तंबाकू रोकने से कितने ही जिंदगी बच जाता है। अभी वो आदमी गरीब लोग जो खा 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 के कितने की मर गए अभी इंडिया में। ऐसा ही सेल करते रहे तो तंबाकू दुनिया में अभी आइंदा कुछ भी आदमी नहीं बच जाता है। कैंसर की बीमारी आके इतना फैला है अभी, ये खुदाने से दुनिया में बहुत अच्छा होता है आदमी लोग को।
Thank you, Asif. Thank you, Reshma. Thank you. Well, this is really the face of the problem. A man terminally ill. He gave up chewing tobacco 12 years ago. But this is a result of that habit so many years ago. This is really the face of the issue.
With the face of the issue, then you really don't need any more warnings on cigarette packets. Siddharth Pandey, just explain what really we're talking about here in terms of the doubling of pictorial warnings on cigarette packets, that deadline which has probably now been missed.
Well, that's right, Amitabh. In fact, we just heard the health minister just confirming for us that we will definitely miss the headline, and India has lost a big opportunity out there. Our neighbors have done exceedingly well as far as warnings on tobacco products are concerned. Pakistan with 85%, Nepal with 90% coverage on their cigarette packs. And this is the problem. This is what an existing cigarette pack in India looks like. Our rules only ask for 40% on one side. Therefore, if you look at this side, there is absolutely no warning at all. On the other side, of course, there is a warning which only covers 40%. This is not enough, is what health experts say, that you need to have it in bold out there so that at least 85% of the pack is covered. And when you go to a shop, it's actually this side that the shopkeeper will show you, and that's not really a deterrent enough. And that's what really is at the crux of the problem right now. The health ministry did not really have to go ahead and accept the recommendations of this committee. They were well within their rights to still stick to the deadline. They have actually decided to defer it. That's a big question. Many people are asking why was that done, but the health minister is saying that they need to give it more time. Most, in fact, just about everyone saying the science is out there. That's not really in doubt. What then is the reason for the delay?
What then is the reason for the delay? In fact, joining us now on the phone line from Gurgaon is a viewer Devkant Agarwal. Mr. Agarwal, do you have a question for Dr. Huku or for the Delhi Health Minister Satyendra Jain?
Yeah, I don't have a question, but I have a question for the Union Minister or the MP in charge who made this comment. One is that it's a personal remark rather, that would love to recommend these products of cigarettes and tobacco to his loved ones? I mean, is he really saying that if it is not, there is no linkage?
Right.
Can we get him on to comment on his personal views?
We will do that, Mr. Kant. We get your point of view there. Dr. Huku, the question here is, do some politicians, especially this statement coming from Mr. Gandhi, who heads that parliamentary panel, have other lobbies in mind, whether it's the tobacco lobby with their own constituents, whether they are farmers who are growing tobacco, who are making these statements?
You see, as a health expert, I would only say that at the end of the day, you spend billions of rupees in treating tobacco related illnesses, and if that amount of money can go into actually treating other diseases, probably a lot of improvement will happen in Indian patients' health. So prevention or keeping people consuming tobacco to the minimum or stop them would actually help the resource of the country.
Cost and benefit analysis there, or possibly even that amount being diverted to farmers who are using tobacco or producing tobacco now to produce other.
That's right. If I recollect a figure which came a couple of years ago, about 300 billion rupees are being spent on tobacco-related illnesses, which would be a significant part of the health budget of the country.
Gagan from Shillong is calling in. Gagan, do you have a question or do you want to air your view here?
I just want to air my views. My views being that the Modi government is doing U-turns one too many. This statement coming from a BJP MP is shocking because BJP was always seen as a conservative party, at least as far as all these issues were concerned.
Right.
And the patriarch of BJP, the RSS, was always of the view that the colonial British were the ones who introduced tobacco in a commercial way by promoting the Indian Tobacco Company.
So Gagan Jain is making the point there from Shillong that why is the BJP making a U-turn. We'll get you more on that, but we do thank our guests in the studio, Dr. Hukku and Satyendra Jain, the Delhi Health Minister. We'll get you more views from patients in a Mumbai hospital and also what the pictorial warnings on cigarette packets are in London.